The diagnosis of leukemia can be devastating to any family. Certainly was devastating to my family, personal experience that I'll share. Luckily, there's an organization out there that helps families through the process, through the devastating diagnosis, treatment, and all the ancillary effects of this horrific disease that still affects countless individuals. The Rob Branham Foundation exists to help families during this difficult time. I'm delighted to welcome Linette Branham, who is president of the Rob Branham Foundation. President or executive director?
President.
Welcome.
Thank you very much.
Office Hours.
Thank you.
So great to have you.
Thank you.
And who was Rob Branham?
Well, Rob was a broadcast professional. He was born and raised in Stamford. You know, spent his entire life in Connecticut, and was in the broadcast industry his entire life. He worked at a number of radio and TV stations in the state when he was alive. He loved water skiing. He collected antique radios and TVs. He was a volunteer. You know, he was your typical loving son, you know, husband,
and your husband,
and my husband, you know, best friend. He was a terrific individual. One of those men who just liked to do things to help other people. Mm-hmm.
And he was diagnosed at what year and how old?
Rob was diagnosed in early 1992.
Okay.
He wasn't quite 42 years old. Interestingly enough, he had only 3 months prior to that run the New York Marathon for the second time, and had shaved 19 minutes off his time from when he had run it a few years before. And his diagnosis was really a surprise to us. He was healthy. It's just that he began to feel like his legs were really heavy. And he went to our doctor for a physical. His blood count came back. His white cell count was a little bit high, but not alarming. Doctor wanted to do the blood work again, which he did. Didn't like it, and said, even though it's just a little bit high, I'd like you to check this out a little bit further and see what's really going on. And by the time he got to the hematologist a couple weeks later, his white cell count had shot up to about 44,000. And as soon as they did the blood work, the hematologist told us he was 99% sure that it was leukemia. And the marrow test confirmed that. It was shocking to us.
What type of leukemia?
Rob had chronic myelogenous leukemia,
okay,
which is the hardest one to fight. And he was an only child. So they could put him into remission clinically with drug therapy. But at that particular point in time, the only hope for a cure for Rob was a bone marrow transplant.
Okay.
So that was our choice.
Yep.
You know.
And how long did he fight the illness?
Well, he did very well. Once he was in clinical remission, he did very well. They looked for a donor, and we were fortunate because they found 2 potential donors for Rob, which is almost unheard of.
Sure.
And he went into the hospital in July of 1993. He went through the transplant beautifully. You know, difficulties that everybody experiences with, you know, the effects of the total body radiation and the chemotherapy that you have to go through. But he did come through it very well. And he came through the transplant itself very well. And he was recuperating, and they decided he could come home. So I brought him home, and the trouble began. Unfortunately, we had difficulty getting the right kind of aftercare for him locally. And he ended up picking up a little organism in the air that everybody who's healthy fights off with no problem. But with Rob, it was unusual. It settled in his intestines, and they couldn't detect it. And it ended up being fatal. He passed away in October of '93.
Okay.
He was only 43.
Yeah, incredible. So his legacy lives on through his foundation.
Right.
That
right.
you started when? And how did that come together?
Well, I remember distinctly the day that Rob passed away. Some of his friends said to me, Lynn, when you're ready, we want to do something special for Rob.
Yep.
Rob had been private about his diagnosis until he was almost ready to go into the hospital, because he didn't want anybody to think he couldn't do his job, because he was out there in the public all the time.
Sure.
And then when we were getting ready, he said to me, you know, when I come back, I want to be the poster child for the National Marrow Donor Program, you know, and really work with the NEMDP, the New England chapter, and the Leukemia Society more to help people become more aware of the need for donors. So a few months after Rob passed away, we started to talk about what we could do. And we decided that the best thing that we could do to honor Rob's memory was start a foundation that would try to do some of the things that Rob wanted to do. So we put together all the best things that Rob liked. And initially, a lot of our focus was on testing drives. Drug therapy has changed that a great deal now. And so our focus over the years began to shift. And now our primary focus is on working with families to provide informal emotional support and especially direct financial assistance, because we know how devastating this can be to a family.
And as you know, my niece, Zia, was diagnosed with acute lymphoblastic leukemia when she was 3. So we were just dumbfounded out of the blue. And where do you go from here? Well, we were throwing up our hands. Oh my God, what do we do? And this beautiful 3-year-old child. And, you know, thank God she is now 10 and robust. And but my family and my sister and her husband, you know, went through so many emotional issues, financial issues. My sister had to give up her job, and you know, thankfully there were a lot of people to rally for support, but there weren't a lot of resources to just kind of lean on to kind of help share the experience with. So your organization really seems to fill that gap of what do you do the day after leukemia is what you know, where do you go from here? So you tell me how it works, how a family like mine would find you in the process. What can you do to help a family?
Well, there are a couple things I'd like to point out. First, if I could, John, you know, most people think of leukemia as being a childhood disease. And a lot of times when they think of that, they don't think of how that impacts the income of the family. As you said, your sister had to give up her job, and that is typical. Because the child needs so much care and needs a parent right there. What a lot of people don't realize is that leukemia, for example, strikes about 10 times as many adults as children. Now, we not only work with families with leukemia, we also work with families who are fighting other blood cancers like lymphoma, non-Hodgkin's lymphoma, myeloma, myelodysplastic syndromes, and there are several different kinds of each. So there's a broad range of blood cancers. When the patient is an adult, the effects are just as devastating, and financially, they can be devastating even more quickly. You know, the patient gets to the point where he or she can't work because the treatment is so tough. And they often use their sick days, if they have any, rather quickly. So they have a significant loss of income. And they dwindle, their savings dwindle very, very rapidly because they're trying to cover their mortgage or their rent, the utility bills, you know, put groceries on the table, pay their health insurance co-pays.
Take care of their other children.
Take care of their other children, you know, clothing, shoes, whatever it is. And a lot of times what we see is the families really cut down to the bare bones. You know, we've had families who haven't even gone out and rented videos because they couldn't spend the $3 or the $4. You know, they cut out internet and cable TV and everything they possibly can to cut their expenses. But what happens is, until the time when the patient is eligible for disability, they have a significant loss of income. And yet, the mortgage still has to be paid. And they also have medical co-pays that have to be paid at the time the service or the medication is provided. And a lot of our families are forced to make a choice. What do I pay for? I have to have the medication, so I'm going to pay for that. That means my electric bill is going to have to wait. My mortgage is going to have to wait. And the interest on those bills mounts up. And sometimes getting into a repayment program is very difficult because our families also don't understand often what their options are for repayment, because they've never had to face this before. And they're so stressed out just trying to deal with the disease and keep their family intact that so many things fall apart. So they get to the point where they're just so overwhelmed. And that's when we often step in. Now, they have to work through their hospital social worker first because of several factors. Oftentimes, there are programs at the hospital that can provide some sort of assistance. So we ask that they go there first. There are also some other great organizations in Connecticut that help families to a certain extent. We try and help families access those resources in addition to accessing our resources. So we don't say we're your last hope, but we say, are you aware that there are other avenues that you can go to also? So they have to fill out an application, and we need to get the reference from this, the social worker. They need to document their need, which is fair, I think. Sure. And then we look at every case individually, and we look to help the neediest of the needy families, because we know that if we don't, they could end up facing eviction, foreclosure,
sure.
Utilities turned off. And that is the last thing that anybody deserves when they're fighting an illness like this. Nobody should be forced to make that choice. So we step in and we determine what they need and for how long a period of time they need it before they have some sort of income that will at least get them to the point where they're stable.
Mm-hmm.
And we try and act appropriately and accordingly.
So the foundation was started what year? 1990?
1994 officially.
Okay, so it's been over.
But it's only been, well, it's the last several years that we've really ramped up our assistance to families. Initially, we started working with families strictly through word of mouth. Our first family came referred to us by an oncology nurse in a hospital. Mm-hmm. Our next family came to us because we happened to see a story in the local paper about this family. And so initially they came kind of hit or miss. And we were still doing testing and some other things also, building a website so that we could have a lot of information in one location for our families. And then we started working through hospital social workers, determining that that would help us really identify better the people who really need assistance.
How many families have you helped over the years?
Well,
off the top of your head.
It's not a great number of families.
But it's the quantity.
It's the quality of the assistance. Yeah. You know, over the last several years, it's maybe 18 families.
Yeah.
However, last year alone, for example, over the last, I'd say, 3 to 5 years, we've probably provided slightly more than $100,000 in grants to families. Last year alone, we provided more than $50,000 in grants.
Wow.
And what we want families to understand is that there are no strings attached. We don't ask for anything in return.
That's wonderful.
It's a grant. It's not a loan.
Now, where do your monies come from? How do you raise your money for the foundation?
Some of it is personal donations.
Yep.
And the rest is fundraising. That's the primary source of our income. So fundraising is important to us. You know, we would like to be able to give more. We could, truthfully, work with 10 times as many families every year. But our funds are limited, just like, you know, any small organization's funds are limited. So we're always looking, and we have laid out a fundraising campaign for this year, and looking to raise a lot more money this year, because we want people to know that the great majority of what we raise goes directly to families. And I mean the great majority, probably 95% at this point.
That's incredible.
We're an all-volunteer board.
Sure.
And we're always looking for pro bono work, you know, and anything that we can get people to donate to us.
And you have a big fundraiser coming up. Here we are in February, so this is enough time for people to know about this exciting event, which I'm coming to. Tell us about this event.
This we think is going to be a really fun event. we're always looking for fundraisers that are exceptionally fun and different. Rob really liked to participate in fundraising, and he did a lot of that when he was alive, especially for the Advertising Club of Connecticut, which he was an active part of. We did fundraising for the Leukemia Society. So this one's different. This is called Mind Over Magic, and it takes place on Saturday, March 12th.
Great.
It is a dessert buffet and a show. And the entertainment is a gentleman named Keith Matheny. He is a nationally known mentalist, entertainer, but he's a motivational entertainer. Now people say, so does that mean he's a psychic? No. And he'll be the first one to tell you, I'm not a psychic. I don't have supernatural powers. I don't use gimmicks of any sort. I have just developed the power of my mind. And what he does is come in and he demonstrates that how you can develop the power of the mind to remember things, to predict things, to do things that most people think are just unimaginable. And he does it in a very entertaining, motivational way.
Fun.
So we think it's going to be a lot of fun. A lot of fun.
Date, time, location?
It's Saturday, March 12th.
Okay.
7 p.m.
Okay.
At the North House, which was Avon Old Farms Inn.
Great.
And that's been renovated and whatnot. We're also including a small auction. We'll have a teacup auction and a silent auction as part of that. So that'll be part of the fun involved in it.
Yeah, I'm excited about it. And we'll flash up in an invitation. And also your website. How do we get to what's your website?
Our website is www.robsfoundation.org.
Yeah, it's a great website.
And we also have a Facebook page, and there's information about the event on both the Facebook page and the website. And tickets are available through the website.
Now, people can also just donate to you.
Absolutely.
Watching at home.
Absolutely.
Outside the event, they can write a check too.
Absolutely. There are a couple different ways that people can donate. They can send in a check if they'd like to, and our address is right on our website. They can donate electronically through our website.
Great.
Or they can donate via their electronic device.
Nice.
All they have to do is text donation. Well, at this point, if they text to 41444, they can. I believe they can text donate, but they can also text. They can also donate, and probably most easily through our website, and just click on the donate button.
That's great.
Yeah.
Now, you and I were talking recently about how you get down and deep with families in terms of working with creditors, which I thought was interesting. That, you know, a lot of families face, you know, paying their mortgage or paying a bill, a utility bill, and a lot of these vendors don't understand that the Smith family is dealing with this ravaging illness. So you kind of act as a go-between, right, to these organizations and broker a settlement.
Absolutely. We try to do that. We at the time that we're especially going to provide financial assistance, we had an instance, for example, last year where the particular family was threatened with their electricity being shut off on a particular date. They had already received a couple of letters, and they were also threatened with eviction and scheduled to go to court. And through our efforts, you know, I got on the phone and I spoke with the utility company, I spoke with the manager of the property and assured them that the family would be getting financial assistance, and some of that would be covered. You know, so would they please not turn off their electricity and please cancel the court date, you know. And we were successful in doing that.
That's great.
You know, as I said, a lot of our families don't know how to navigate the system. You know, so we've tried to also help connect families with organizations that are out there, like the Connecticut Action Network. I think it's called the Connecticut Action Network. Yeah. And help families connect with other people who can help them, who have a direct connection to the utility companies or whoever it is that they need. But we're more than willing to do that because families are so stressed out, as I said, they just don't have the time to do this.
Yeah, it's just treading water. It's just
it is. And emotionally they're so strung out that they just don't know which way to turn.
Now, what about the emotional support? Do you kind of connect them to support groups or? That
we don't do. Most of our emotional support is very informal.
Yep.
You know, in talking to the family, you know, helping to assure them that, you know, we can help them financially, helping to direct them to other resources.
Yeah.
You know, there have been times when I have directed people to support groups and said, you know, take a look at this website or talk to this person here. But it's interesting because a lot of our families don't have the time, you know, to go to a support group meeting because they're trying to keep their family intact. And as you said, if they have other children, those other children go through so much emotionally.
Absolutely.
That people don't even think about.
Yeah. Yeah,
You
you're
know,
right.
as a quick example, we had a family we worked with a couple years ago. There were 2 children, and the younger child was the leukemia victim, and she had had a transplant and still was having multiple problems. And as it turned out, there was mold in the house they were living in. They needed to move as quickly as possible. And the older child just was so worried about where are we going to live and how are we going to do this and how is my sister going to be. And because of the extent of the mold problem, they had to get rid of everything they owned that had cloth on it.
Oh my God.
Mattresses, furniture, clothing, toys. And you know, this takes its toll on children when you see things just needing to be eliminated, and the parents, of course, were beyond themselves, you know.
Yeah, my sister's youngest son, we noticed he wasn't eating a lot, and went to a therapist. He was only, oh my gosh, 3 or. But anyway, it turns out that he was seeing his sister get sick all the time because of the leukemia and the treatment she was getting, and he was associating eating with getting sick. So there was, you know, you don't think about that, but this poor little kid,
you don't.
He's watching this and not understanding it. So that's another collateral damage, if you will, fallout from this illness. There's so much collateral damage.
And when the patient is an adult and that patient is out of work, and the other adult is trying to work, you know, to make sure there's somewhat of an income and keep the family together and make sure that, you know, the kids still get to soccer practice or wherever, and do all of those things and make sure the patient gets his or her medication, gets to doctor's appointments on time, and so on and so forth. It is just emotionally, you know, it's crippling. It's absolutely crippling.
Well, thank God your organization exists, and it sounds like it's growing.
We are growing.
And sadly, the need is growing, but you're filling that need. And I think you're looking to maybe add to programs or staff, possibly.
We are. The program, we have 2 programs that we work with, one more than the other. I mean, we have several programs, but the financial assistance programs. We have one that's called Rob Right Now. And that is an emergency, I'm in trouble today assistance program. And we don't require as much documentation to give that assistance. There has to be some, but we don't require as much. And the decision-making process is left to me and only me. Our program, Rob Direct, is the other bigger program that most of our patients fall under. And that's the one where they work through the social worker. And the reason for that is because the amount of assistance we give varies so much, and because there is no real cap on it at this point in time. However, we want to expand that program especially so that we can work with the families more, because my time is so limited, and we're an all-volunteer board. And our time is very limited as to how much time we can actually spend with a family to sit down and help them fill out an application for another organization. Because as I said, there are other organizations out there that are willing to help, but most people don't know about them because they've never had need for them. They don't have time to research them. The hospital social workers do a tremendous job in trying to help, but they're limited because their caseloads are so big. And they are technically medical social workers who are supposed to work first and foremost on the medical issues that the family has. That's understandable. That's what they're there for. So we're looking to be able to work with a person on a contract basis initially, who can step in and really sit down and work with the families to help them access other resources, help them understand the kind of repayment programs that there are, how to approach their bank, for example, or their landlord about a repayment program or a reduced payment program, how to approach the utility companies or anybody else. So that, because again, families don't know that. You know, they don't know how to access the system.
Well, I am so glad that you were able to join me today to talk to us about Rob. And I wish I had known him. Sounds like an incredible person, but he lives on through the incredible work of your foundation.
We think
and
so.
On behalf of my family, thank you. And for those at home who need the help, I'm hoping you reach out to the Rob Branham Foundation. And I also hope folks at home will be generous and make contributions to this organization. And again, we're going to flash up the website and also go to your big event coming up in March, and they can buy tickets or they can donate auction items, right?
Absolutely. And if people would like to volunteer to work with us at some point, they can let us know.
You're always looking for volunteers.
Absolutely.
Too?
They can volunteer through our website.
It's wonderful.
Yeah.
And so I want to thank you for joining me today, and thank you for your good work on behalf of so many people in need. It means a lot to me. It means a lot to so many people who are going through this experience. So thank you for joining me on another edition of Office Hours with State Representative John Hampton. We'll see you next time. Bye-bye.
Funding for Simsbury Community Television is provided in part by contributions from viewers like you. Thank you.